Ferrari at breakfast on LBC. Call 0345 6060 973.
10 minutes for 8 is the time. So in this battle against COVID, and of course, as we've always tried to, we've accentuated the positives, and there are many. While we have to accept that the deaths per million of population in the United Kingdom has not fared well, most new cases it's still high. As regards the vaccinations, it is a success story, so we give thanks for that. But another game changer could be the idea of tests that allow you, when you're arriving at a theatre, a sports stadium, or possibly even a place of work, an office, a factory, you get a test in fairly short order, and then you'll be able to proceed with your business. Well, apparently there is news now about this idea of new testing. Conservative MP and Health Minister Ed Argar joins me now. What's the news you're announcing today? Minister, good morning.
Morning, Nick. Nice to see you again.
Good to see you, sir.
Well, the news which you quite rightly highlighted there is the contract has been signed with Shaw Screen for 20 million lateral flow tests to do exactly what you've said. And the other key bit of this is a great British company, as it was. It's Derbyshire based, so it's a homegrown company, homegrown bit of kit, and therefore it can play not only a key role in helping provide employment and supporting British business, but also that these tests can play a role, not the only thing, not a reason not to be vigilant, to follow the rules, to have your vaccination, etc., but another key tool we will have for people who may be asymptomatic, if they're going to go into the office or they're in the office, to have a quick test while they're there just to see whether they're asymptomatic, whether they're not. It should work to help make that easier for people.
Briefly, Minister, walk through, for the benefit of my listeners, walk through what the person has to do and the sort of timing that you're looking at to get the result.
Well, this the lateral flow test, in terms of your latter point, it's about half an hour, give or take. So it's a very rapid turnaround. And this is a nasal swab put into a liquid, and it will give you a result in half an hour or so as to whether you are COVID positive or COVID negative. It's not, as I say, it's not an alternative to doing the right thing, to being cautious, to washing your hands, to hands, face, space. But it's just another tool that will hopefully help our businesses and others as at the right time we start to ease restrictions, another tool to help keep this disease in check.
All right. Minister, while I have the benefit of you on the line, I wonder if you could address a couple of other issues. It's reported by one newspaper that there could be an amnesty for illegal migrants so they could have their vaccinations, around 1.3 million. Is that correct?
So what we're saying here is, first of all, no one will get their vaccination out of turn, as it were. We'll still follow the scientific advice and everything else. But what we've said throughout with this disease is interested in looking for victims. It's not worried about their immigration status or anything else. So we have said, absolutely right, that those people will be entitled to the vaccine at the right time, just as we've said that people who have a COVID test or need treatment for COVID, we are not going to chase up their immigration status around that. The key here is we want to tackle this disease, we want to keep people safe, and we want to tackle it across society. We need to do that with everyone to protect our country and to make sure that we get this disease under control. And that means vaccinations, yes, as reported in the, I think it was the Mail.
It was.
I could be wrong in my recollection.
No, that's right, it was.
Yes.
And what of those who aren't perhaps registered with their GP? What would happen to those individuals, Minister?
Well, we're encouraging people to register, but equally
sort of no questions asked. Come forward, get your jab, no questions asked, to get herd immunity.
We've already said, Nick, with, for example, treatment and tests for COVID, whereas normally, because of the system we have for charging people from overseas for some treatments, normally you would check things. This is a notifiable disease. We said we're not going to do that. It is more important we just tackle this disease. Come forward. Don't let that put you off from having a test, from getting treatment or getting vaccinated, because as a country, we want to get everyone vaccinated.
All right. Is it possible, as another newspaper suggests, we might need a third booster and it could be ready by the autumn? How confident are you on that, Minister?
So in that context, we have this with flu, for example. The flu vaccine, our flu, much less dangerous disease, kills a lot fewer people each year. But the principle is the same, that these diseases try to mutate, they try to outwit us and what we've done to try and beat them. So with flu, every year, about now, scientists start thinking about how it's changed, how we need to tweak that basic flu vaccine to be effective. That's exactly what we will be looking to do and are already doing with the COVID vaccine. CureVac is an amazing company, does a lot of work around genomics to understand how it's changing. We're already working with them to make sure we can tweak the vaccine. And then, as we all would in an average autumn or winter, we pop into the pharmacy, we have our flu jab to top us up each year. It's the same sort of principle.
But this autumn, my question was, how confident are we could be in a good place for this autumn, Minister?
Well, I'm and you'll know from the time I've been on your show before, I'm always slightly cautious in making predictions or promises about things. But I am cautiously confident, if that's possible, that we're making really good progress on this first wave, the first phase of vaccine rollout, 12 million done so far. I'm confident we'll continue getting those jabs in people's arms, and that by autumn we will be able to do those additional jabs for boosters, if you want to call it that, as required.
Lastly, one group of people, sadly, who don't seem to want their injections, their arms, are in certain parts of London. You might have heard of the John Scott Vaccination Centre in Hackney. Don't worry if you haven't. Sadly, it had to close 3 days early last week because it's in very much a multicultural part of London. And for 3 days, they weren't able to operate flat out because people are just not coming forward. How is this to be addressed? There is still concern, is there not, uptake in certain BAME communities?
Yeah, and I do actually know about that story. Before I was a Member of Parliament, I was a councillor in London for about 10 years. So right. I know the capital fairly well. You're absolutely right to highlight this. And I think Nadeem Zahawi, talking to various outlets, media outlets yesterday, highlighted this, that 85% of the population said they would be highly likely to have the vaccine. Of the 15%, though, he highlighted that was very disproportionately skewed to some BAME communities and others, saying they were not comfortable about having it. And therefore, a huge amount of work is being done in terms of promoting the vaccine, in terms of different languages, in terms of using community leaders, engaging with community leaders, trusted community leaders, to highlight the benefits of this vaccine. The vaccines save lives. And you'll have seen a large number of my colleagues across party, because this isn't a party political issue, put out a video, I think it was a week or so ago, again, reaching out and highlighting that. We want everyone in whatever community in this country to come forward for this vaccine. I believe it saves lives. As soon as I'm eligible for it, I'll certainly be having it.
I'll race you to. In fact, I think I'm going to be ahead of you, actually. I'm a few years older than you, so I'll let you know how it is. Just lastly, GPS tracking to ensure travellers' quarantine could be used as an alternative to mandatory hotel stays. The government advisors are suggesting. Where are you on that idea? We'd be tracked by our phones to make sure we abided by what we said we would when we entered the country.
Well, Nick, you always savvily try to tempt me to speculate on speculation when I come on your program.
It's my job, Minister.
And I fear on this one I won't. I mean, what I would say, a serious point, is we have a very robust, multi-layered approach to getting people to fill out those passenger locator forms, to quarantine when they get here, and that the hotel quarantine will be an additional layer to that to strengthen it. But I fear you won't get me to speculate on speculation.
Best of luck. I'll let you know what the jab is. I sense I will be a few weeks ahead of you. Thank you for appearing on the show here. Health Minister Ed Argar. 2 minutes before 8 is the time. Hamilton's in Hackney. Let's talk passports with you. You're on the radio. What are you going to tell me? Would you feel safe to travel, let's say, somewhere in Europe, Hamilton, as a result? Good morning.
Good morning, Nick. Yes, but I think, as you know, when you book a ticket to go abroad, and we've all done it, you can do everything except you can't press go and get your boarding card distributed to you or printed out or whatever until you enter your passport details. So if you've had the vaccination, I think it should be linked in with a passport company, so therefore nobody can travel. I'm not talking about public transport in this country and all that.
You mean